Hi everyone, I'm Hannah Brown, one of the senior nurses working here in Cancer Services. It's my pleasure to welcome you to this film. Cambridge University Hospitals is a family of hospitals comprising Addenbrooke's and the Rosie. Throughout this film, you may hear the hospital referred to as Addenbrooke's or CUH. No one wants to have a cancer diagnosis, but we hope to make the experience of treatment as good as it can possibly be for you or your relative or friend. Here at Cambridge University Hospitals, we care for thousands of people a year diagnosed with cancer, and we are proud to provide some of the best care and most advanced treatments in the country. We are the regional centre for rarer types of cancer and also the local hospital for those living in the Cambridge area. We offer cutting-edge research options for many people. Treatments offered here include surgery, radiotherapy, chemotherapy, immunotherapies, stem cell transplantation, and even newer treatments, for example, CAR-T therapy. Our teams are highly trained and specialised, and you're in safe hands here at CUH. A cancer diagnosis certainly causes disruption, and we try to minimise this wherever possible. For example, by offering telephone or video appointments and blood tests locally whenever appropriate, and offering some chemotherapy treatments in the community. You can ask your care team about these options. The multidisciplinary team includes allied healthcare professionals, such as physiotherapists and dietitians with specialist cancer knowledge. Clinical nurse specialists work in all specialty teams and will be one of your main points of contact throughout your treatment. Your clinical nurse specialist will be an expert in their field and will provide support and advice for you. We have a fantastic cancer support service here at CUH who works closely with the multidisciplinary teams to provide holistic care for people living with cancer and their families. We work with a range of partners including Macmillan, Maggie's Centre and Cancer Research UK, amongst others, which enables collaborative working to meet the unique needs of each patient. We take pride in listening to our patients and aim to ensure that any service changes involve patients, so please do feedback to us about how we're doing. We're really excited about plans to continually improve our services, and patient involvement is key to getting these changes right. We hope the information in this film about our current services and facilities will help you navigate your way about the hospital and offer some useful advice. Thank you.
I'm Paul, one of the patients working with the staff at CUH. Getting to hospital may feel challenging at first. However, there are lots of options for travelling available to and from CUH. There are many routes leading to the hospital, including Hills Road, Long Road, Trumpington Road and Addenbrooke's Road. They all have dedicated cycle lanes, as well as off-road paths, some of their length. The bike racks are available to use around the campus, and the closest to Oncology Haematology outpatients is located next to Clinic 14, the eye clinic on Robinson Way. Addenbrooke's Hospital has its own bus station at the Hills Road entrance to the site, where the majority of buses pick up and drop off people. There are further stops around the biomedical campus. However, the closest to the Oncology Haematology outpatients is the Addenbrooke's bus station. The Cambridge railway station is an easy walk or short bus ride away from the hospital. It takes approximately 10 minutes by bus or 30 minutes walking to get to CUH. There are taxis available outside of the train station, which can take you to CUH if needed. There are also a number of local taxi firms operating around the hospital site, and these include Panther Taxis, A1 Cabco or CamCab. You can contact them directly or ask the reception team to order one for you if necessary. When travelling by car, the hospital is well signposted from most parts of Cambridge. If driving from outside of Cambridge, there is easy access to the campus via Addenbrooke's Road, signposted from Junction 11 on the M11. There are two main multi-storey car parks available for patients and visitors at CUH, Car Park 1 and Car Park 2. Cancer patients receiving chemotherapy or radiotherapy can park in the disabled bays on any level in car parks 1 and 2, as they are also designated for cancer patients receiving treatment. Other disabled parking bays around CUH are only available to blue badge holders. If you are asked for evidence, all you need to do is present your appointment details. Car parks 1 and 2 each operate a pay-on-foot system where customers make their payment for the period of time they have parked when exiting the car park. Patients can take their car park ticket to Oncology, Haematology outpatients or Radiotherapy reception to receive a daily or weekly stamp that enables them to be charged a discounted rate. The stamped car park ticket will then need to be taken to the customer service desk in car parks 1 or 2 for processing. If you are a blue badge holder, parking is free in both car parks. You will, however, also need to get your car park ticket stamped and take it along with your blue badge to the car park customer service desk for authorization before you leave. If you have any further questions about car parking, you can speak to the customer service team located on the ground level in both car parks. There is a free courtesy bus available to use, running every 30 minutes from car parks 1 and 2. The bus can drop and collect you from the main entrances. The Oncology Haematology outpatients entrance is one of the stops included on the schedule. Please ask at any reception desk for instructions. Another option for car parking and travelling to and from hospital is one of the many park and ride services available around Cambridge. The closest park and ride site to CUH is located on Babram Road or Trumpington, but you may find it easier to use one of the other sites, depending on the direction you're travelling from. You may also be eligible for reimbursement of fuel and parking costs via a Macmillan grant. Please visit the Cancer Support Information Service or ask your cancer navigator or healthcare professional for more information. Patients are normally expected to make their own way to and from hospital for non-emergency tests and treatments. However, this may not be possible if you have a medical condition that prevents you from travelling on public transport or in taxis. Where necessary, hospital transport can be provided for both inpatient stays and outpatient appointments. You can contact your transport provider to see if you are eligible for patient transport service. If you are unsure who your transport provider is, please contact either your GP surgery, the clinic you are attending, or the transport office at Addenbrooke's Hospital. For more information about getting to Addenbrooke's Hospital, please visit the CUH website.
I'm Helen, one of the patient representatives working with Cancer Directorate staff at CUH. The check-in process here at Oncology Haematology Outpatients Reception is very easy and straightforward. When you first approach the reception desk, you will be greeted by a receptionist. You will then be asked to provide your name, date of birth, first line of address and postcode, phone number, GP practice, and details of your next of kin. The receptionist will then ask if you are an NHS patient and what country you have lived in for the last 12 months. You may also be asked if you have had any COVID symptoms in the past 7 to 10 days. The order of questions being asked depends on each individual receptionist. Patients can now also check all their details online via MyChart before attending their clinic appointment. In this situation, the receptionist will only ask you to confirm your name and date of birth, and may also ask if you have had any COVID symptoms in the past 7 to 10 days. After confirming all the details, the reception team will check if you require blood to be taken. If this is the case, you will be given a ticket with a number and remain in the waiting area. Once the number is announced, you will then go to the blood room and have the bloods taken. The waiting time for blood results can vary and can sometimes take longer than usual due to the volume of requests received at the lab. The specialist team will, however, inform you if the wait for the results is longer than usual. Lastly, the reception team will ask you to get your height and weight taken in the clinic entrance
by one of the healthcare assistants. This is for the clinical team to use as a baseline measurement for routine monitoring and to ensure accurate medication dosage can then be given to you if necessary. Being a patient myself, I have a piece of advice for other patients. Please do not hesitate to ask or check again with the reception staff members if there is something you are unsure about. The reception team is always happy to help.
Hi, I'm Andy. I'm one of the patients working with the Cancer Directorate staff here at the CUH. Once you've checked in at the Oncology Haematology reception, you will most likely remain in the waiting area on level 2 until you are called for your appointment. There are 2 wheelchair accessible toilets available to use and a small coffee shop if you need any refreshments while you're waiting. The Cancer Assessment Unit is located directly opposite the reception. The Radiotherapy department is located ahead of the Oncology Haematology waiting area. You will go past the blood test room on your way to the Radiotherapy reception. There are small waiting areas available at the Radiotherapy department, and one of them is located opposite the reception. The reception staff will advise you which area is best for you to use depending on your treatment. You can also view all the waiting areas and treatment rooms on the CUH website using the Radiotherapy virtual tour. Going back down the corridor from the Radiotherapy, the Cancer Support Information Service Pod is located on the left-hand side next to the Oncology Haematology waiting area. The team has resources in various formats on a wide range of cancer-related issues and will be happy to assist you as necessary. There are also 2 additional wheelchair accessible toilets next to the information pod available for you to use if needed. The concourse and the food court are approximately 3 minutes walk from the Cancer Support Information Service. You will need to go up to the end of the corridor from the information pod, turn left onto the main corridor and continue straight ahead towards the main hospital area, following the signage. The concourse will be on your right. When entering the area, you will find a variety of shops offering different services such as Costa, Marks & Spencer's and the hairdressers surrounding the seating area in the middle. Continuing straight forward, you'll enter the food court with additional eating and drinking areas such as Starbucks, Burger King and Wellspring. Turning right from the concourse, however, will take you to the main hospital reception area located in front of the main hospital entrance. To go back to the outpatients, you will need to turn left when exiting the concourse. You will then continue along the corridor, go to the right, then to the left, and then the main outpatients corridor will be ahead of you. When walking down, you will see the Oncology Haematology outpatients corridor on your right, taking you back to the Oncology Haematology waiting area. If you, however, continue down the main outpatients corridor, this will take you to the main outpatients reception area. The outpatients pharmacy will be immediately on your left. You will also find a coffee shop and the Amigos store here, as well as the transport desk right next to the main outpatients reception. There is a CUH Directions mobile app available for patients and visitors to use, which helps finding your way around the hospital, making it easier to locate clinics, wards and other facilities on the CUH campus.
Every patient we see here at Addenbrooke's Hospital is individually discussed at a multidisciplinary meeting, or MDT for short. This is where all of the different doctors specialising in your cancer type and a number of different specialists involved in your care will review scans, biopsies and your specific needs and recommend a treatment plan for you. You will not be able to attend this meeting, however your key worker or clinician will discuss the plan with you in a face-to-face outpatient appointment, video appointment, or via the telephone. Often, the clinical nurse specialist will be your key worker. Your clinical nurse specialist is your voice at the MDT, and they will feed back information to you which will enable you to make informed decisions about your care and treatment. We understand that coming to a busy department can be daunting, particularly as you may already be feeling anxious about your appointment. We, however, recommend bringing someone with you for your first appointment, someone who can provide support and help with writing down information and assisting you with any questions you may have. We also suggest you bring a pen and a notebook and perhaps a folder or envelope to store your letters and information given to you in the clinic appointment. Sometimes it may be necessary to send you for further scans or investigations on the day. Attending in comfortable clothes, therefore, may be easier for you, such as a wireless bra or t-shirt instead of a shirt. You may meet several different healthcare professionals at the hospital, all involved in different parts of your care. We are all here to help you and your family.
Surgery is one of the most commonly used treatments for cancer. If identified early enough, surgery can be a curative way of treating cancer, often without the need for any further treatment. Sometimes, however, surgery needs to be used together with other treatments, such as radiotherapy or chemotherapy, to give the best chance of long-term cure. At CUH, cancer patients are often seen by surgeons as the first specialists regarding their cancer treatment. Prior to that, however, the patient will have been discussed in a multidisciplinary meeting to consider the best way of treating their particular cancer type. Very often a biopsy will be recommended to identify if the lump is in fact cancerous and needs further treatment with surgery. If surgery has been recommended, the next step is to assess the patient's fitness for an operation. Depending on the location of the cancer and the body part affected, surgery can be relatively minor or extremely major. This will be discussed with the patient in detail to ensure they understand the procedure and that they are fit enough to proceed with surgery. These assessments are often undertaken in conjunction with the anaesthetic teams in the pre-assessment clinic before confirming that surgery will take place. At the pre-assessment clinic, which usually takes place in the Addenbrooke's Treatment Centre, a detailed assessment of the patient's medical background will be completed, as well as assessment of the heart and lungs and blood tests to ensure fitness. Surgery can either be undertaken using traditional open surgical approaches where a large cut is made to access the organs, or by using keyhole approaches where only small incisions in the skin are made. The keyhole method can be undertaken using standard keyhole surgery instruments or by using robotic surgery platforms. This approach will allow for a more rapid recovery from surgery. The location of the surgery will either be in the Addenbrooke's Treatment Centre or in the main surgery complex, located in the central part of the hospital. On the surgery day, you will most likely attend the Addenbrooke's Treatment Centre early in the morning to check in for your surgery. You will then be seen by the anaesthetist and the surgeon and will change into a theatre gown. When it's time for your operation, you will most likely walk into the theatre by yourself. The anaesthetic and surgical team will welcome you and undertake safety checks. They will then administer the anaesthetic before the operation. After surgery, you will return to the recovery area to ensure it's safe for you to be transported to a ward to recover from your operation. Some surgeries will allow us to discharge you home on the day of surgery or after only 24 hours, whereas bigger, more invasive operations may require a length of inpatient stay. During the inpatient stay, you will often meet physiotherapists and occupational therapists who will ensure you are back on your feet and able to get home. Your convalescence will continue at home and you'll be discharged with appropriate medications in order to allow smooth recovery. Generally, the results of your operation will tell us the detail of the cancer that has been removed. Approximately 6 weeks after the surgery, you will return to the clinic to be seen by the operating surgeon and their team. They will check whether everything has healed nicely and whether all blood tests and other assessments are satisfactory. A decision will then be made about the need for further treatment and the method of follow-up. Throughout your treatment, for the vast majority of cancer types, you will have access to a cancer nurse specialist who will be your first point of contact to ask questions or raise concerns that you might have either before or after the surgery.
Radiotherapy is a treatment where radiation is used to kill cancer cells. It may be used in the early stages of cancer or after it has started to spread. It can also be used to make other treatments more effective, reduce the risk of cancer coming back after surgery, or relieve symptoms if a cure is not possible. At CUH, radiotherapy is delivered using either a linear accelerator or the insertion of radioactive implants, otherwise known as brachytherapy. Most patients require a planning CT scan at the beginning of the radiotherapy journey. This is used to create a bespoke plan for each individual person. There is usually a waiting between planning scan and the first treatment. This is because it takes a significant amount of time to create the plan and to quality check it to ensure the best plan is offered to each patient. We have a number of different treatment machines available at CUH, and we will choose the best one for you based on your diagnosis. You may be required to attend for a single treatment appointment or be asked to come back Monday to Friday for a number of weeks, including bank holidays. We also open our service up on a Saturday if required. Treatment appointments last around 10 to 20 minutes each and are delivered by a team of radiographers. This involves positioning the patient using bespoke equipment, position verification using X-ray imaging, and treatment delivery using high-energy X-rays. Some patients require preparation before they have radiotherapy, such as drinking water to achieve a full bladder. The team will advise if this is required when attending for the planning CT appointment. Radiotherapy side effects are specific to the area being treated. Common side effects include tiredness and reddening of the skin. We would expect these to start after a few days of treatment, peaking around 1 to 2 weeks after the last treatment is delivered. Each patient may, however, react differently to radiotherapy, and your treatment team will discuss any side effects with you if they occur. For more information and virtual tour of the department, you can visit the radiotherapy page on CUH website.
As part of a cancer treatment plan, patients may require drug treatments, commonly known as chemotherapy. Chemotherapy is one of the type of drugs used to treat cancer, but other treatments, such as immunotherapies, hormones, and targeted therapies, are also regularly used. Treatment options recommended to each patient are individualised based on the type of cancer, genetics, the patient's wishes, and risk factors. These treatments can be given before or after surgery, or alongside radiotherapy. The type of treatment received by a patient will be decided following a discussion between the patient and their clinical team. The patient can be accompanied by their family or friends or anybody they'd like if they wished. Treatment drugs can be given in different ways. Some are given as tablets, some as a fluid into the vein called intravenous, and injections into the skin, or in a pump which may need to be taken home. The way the treatment is given depends on how the research has shown it is most effective at treating your disease. It is most common to receive treatment in blocks, known as cycles. The length of a cycle is measured in weeks, and it depends on the type of drugs given. When on treatment, a patient will have regular appointments with their clinical team to ensure they are well enough to continue with the treatment, or to assess if any changes need to be made. As part of this, most patients will also have blood tests taken. Depending on the treatment, it is possible to receive your drug therapies in different areas. Most patients are seen in one of our cancer day units or GP outreach sites, where treatments are also given by CUH cancer nurses. The Oncology Day Unit can be found off Robinson Way and accessed through the Oncology and Haematology outpatient main entrance, or from inside the main hospital through the outpatients department. The Haematology Day Unit is located opposite the main hospital entrance. The GP outreach sites, however, are only available for certain treatments and will be discussed with you in clinic if appropriate. The Acute Oncology and Haematology Service provides telephone support for cancer patients who are currently receiving treatment such as radiotherapy, chemotherapy or immunotherapy under the care of an oncologist or haematologist. The phone line is open 24 hours a day, 7 days a week, and can be used by patients, loved ones or professionals. We provide emergency support for patients who are struggling with symptoms of their disease or complications from the treatment itself. This support is given by trained cancer nurses and doctors. Where possible, we aim to keep you out of the hospital if this is a safe option for you. When it is advised that a patient needs to attend hospital, we aim to do this via the Cancer Assessment Unit, or CAU for short. The Cancer Assessment Unit can be accessed via the Oncology and Haematology outpatient main entrance on Robinson Way. The CAU is a 9-bedded unit used as a space to assess and treat patients needing urgent care due to a complication of their cancer or treatment. These patients may stay in the unit for the day and then go home, or be admitted to a ward if requiring a longer stay. When admission is necessary, the CAU team will liaise with the senior clinical team to ensure the process is as smooth and as easy for you as possible. All CUH cancer patients receiving non-surgical care are given a red emergency card containing the 24-hour helpline contact numbers for oncology and haematology patients. This is for you to contact the clinical team when necessary, so please ensure you always carry the card with you.
Finding out you or someone close to you has cancer can be a very difficult and confusing time. Whether you're here for treatment or supporting a family or friend, our cancer support service are here for you. Our base is in oncology, haematology outpatients, and we satellite to other parts of the hospital, such as the Adam Brooks Treatment Centre and the main concourse. Our team can come to see you on the wards or day units, and you and your family can drop into the service for support or information. Our cancer support advisors are available Monday to Friday, and you do not need an appointment. You may be assigned a cancer navigator from our service alongside your clinical team. They will contact you to offer support and access to services that may be important to you at different points. Receiving a cancer diagnosis can affect many parts of your and your family's life. We can help with a wealth of information available, from financial support, work, emotional support, and services closer to home. Our Cancer Patient Information Pack is also available and can be picked up from our information service or through your clinical team. We can provide you with a digital copy as well if you prefer. The pack contains practical information about the department, such as parking and services available on the Adam Brooks campus. We work closely with Maggie's Centre Cambridge, who are based on the Adam Brooks site. Maggie's offer a quieter space away from the busy department to seek support and information. You can meet others or to simply have quiet time with a cup of tea in a calming space. They offer support groups and information sessions, psychological support, and have their own benefits advisor as well. The centre is open Monday to Friday and no appointment is needed. You can find out more information on our service at the Adam Brooks website or pop along to our base in Oncology, Haematology outpatients and speak to a member of the team.
Here at Adam Brooks, there's a strong commitment to listen to patients' recommendations and suggestions. Some aspects of the treatment you will receive are the direct result of previous patients and carers asking for changes. I am involved in the Cancer Patients Partnership Group, or CPPG for short. We're a friendly group of patients and carers with lived experience of cancer. We work as equal partners with healthcare staff to deliver improvements in cancer care. We want to make sure that any change or improvement in cancer services starts from what matters most to the people who use those services. Patients themselves are in the best position to decide what works and what doesn't, and it's vital that the patient voice is heard. The CPPG has the opportunity to attend meetings with the leading cancer specialists and hospital managers to ensure that patient concerns and suggestions are on the agenda. We are involved in the design of patient information sheets and letters, patient waiting areas, reviewing the quality of hospital food, and expanding holistic, all-round care such as dietary advice, exercise, and physiotherapy. We have also been involved in research and the development of a medical device that will give early warning of neutropenic sepsis, vital for patients whose immune systems are weakened by treatment. But patients can bring any topic to the meetings. Please feel free to check out our CPPG page on the CUH website, or ask any of your healthcare team for contact details. We meet once every 2 months, either online or in person. Travel and parking expenses will be reimbursed if you decide to get involved.
More information about cancer services at CUH is available on the CUH website under Cancer Services section. The details and a contact telephone number to your clinical nurse specialist will be provided to you at your first consultation. The clinical nurse specialist will make every effort to clarify any information and discuss matters important to you. However, you can contact them should you have any worries or need further information when staying at home. You may have to leave a message, but they or another member of the specialist team will get back to you as soon as possible. If you are unsure who your clinical specialist nurse is, you can contact the Cancer Support Service. You can also contact your navigator or the Cancer Support Advisors to help you with any non-clinical queries. In emergencies, you should ring the 24-hour emergency number, not your specialist nurse, so you can talk to someone and obtain immediate advice. Always carry your emergency contact number with you, along with your hospital number. You can also give this emergency contact information to your close family members. Besides, you can also register with the electronic patient record system called MyChart, which enables patients to securely access parts of their health record held within the hospital's electronic patient record system. MyChart will allow you to access information such as upcoming and past appointment details, clinical correspondence, test results, medications, and also enable you to communicate with your treating team if this function is available within the clinical specialty caring for you. MyChart is designed to improve communication between patient and clinical teams and enables patients to be more involved and informed about their care. Once signed up, you will be able to access your information via MyChart from your smartphone, tablet device, or from a computer or laptop. Thank you for taking your time to watch our Welcome to Cancer Services patient information film.